I just remembered I had the Lead Connect Care background on my hard drive somewhere, so I just put that up. Okay, welcome everybody. So my name's Drew. Just to introduce myself, I work for an organisation called Turning Point, which, if you aren't aware, Turning Point is the commissioned drug and alcohol service provider in Leicestershire, Rutland. The way drug and alcohol services work in England, at least, is that each local authority area says we need a drug and alcohol service, and certain companies bid for that contract. And Turning Point is one of the companies that bids for these contracts. And in 2016, it won that contract in LLR. Prior to 2016, there were lots of different drug and alcohol agencies dotted around the place. There was, say, the NHS city alcohol team, the county alcohol team, drugs, young people, the prison, the probation service, the criminal justice drugs team, which is actually my background. That's where I was from prior to 2016. And then there was the hospital alcohol team. And actually that's where I work now. So after 2016, all those agencies were put under the Turning Point umbrella, which kind of makes it really useful if you're a patient or a member of the public moving around the county or the city, in and out of prison, in and out of hospital. You get kind of like a joined up service. So for me, this training is kind of like a sideline for me. My day job is I'm based in the Leicester Royal Infirmary in the emergency department. I'm part of the drug and alcohol liaison team there. So my kind of day-to-day job is dealing with people who've come in with overdoses or withdrawal, or they've had way too much to drink, liver damage, all kind of like the most extreme physical consequences you can imagine when it comes to drug and alcohol use. So it's like the thin end of the wedge. What we're going to be talking about today is some of the preamble to those extreme consequences. We're going to be talking about alcohol. We're going to be talking about how much is too much, what some of the consequences of drinking too much can be, which needn't just be physical health problems. It can be mental health problems. It can be financial problems, relationship problems. You can lose your job, you can get in trouble with the law. All kinds of things can go wrong if you drink too much. We will be covering some of these things in this session. You might have done sessions about alcohol before. I'm hoping there'll be a few bits in here that will hopefully be new to you. So hopefully it should keep you stimulated. There's a lot to get through though, and I do talk rather quick, so we'll see how we get on. And at the end, I will talk a bit more about Turning Point and about how you can refer people in for some ongoing support, and what kind of help is available. So we'll do that at the end. Okay, but today we're here to talk about alcohol. Just some stats about alcohol, really, just so we get a kind of some of the context of kind of where we're at nationally speaking. This is in England. 40% of adults in England are drinking at levels which pose some risk to their health. I don't know how many adults there are in England, several tens of millions, I would imagine. So 40% of that is still tens of millions of people drinking at levels which might cause some risk to their health. And we'll be talking more about what those levels are and what those risks may be as we go on. Again, in England, an estimated 600,000 adults physically dependent on alcohol. And we will be talking lots more about physical alcohol dependence when we get there. Basically, this is people drinking so much that their body comes to expect alcohol. And for alcohol dependent people, if they were to stop suddenly, then actually they would go into withdrawal. So we'll be talking a lot more about alcohol withdrawal when we come to it. Alcohol has been identified as a causal factor in more than 200 medical conditions. It used to be less. It used to be at 60, but some piece of research was done and the number shot up to 200. Basically, when you have a drink of alcohol and it gets in your bloodstream, it gets to every single cell in your body. So there is no cell in your body that is not exposed to alcohol when you have a drink. So with that in mind, you can imagine that there's no part of your body that can't go wrong if you drink too much. We will touch on a couple of those as we come to it. There are over 1 million alcohol-related hospital admissions every year. Bearing in mind, I work in a hospital, so if you ask any doctor or nurse in casualty, how many people do you get a week, and they've come in because they've had too much to drink, and they will roll their eyes and say far too many. So if we can help people spread awareness like this kind of session, get people to maybe moderate what they're drinking, hopefully we can speed things up at A&E a little bit. There's a huge problem health-wise. Alcohol accounts for over a third of all cases of liver disease. We'll be talking more about livers later. Right, a bit closer to home now, where we live in Leicester, Leicestershire, Rutland, there are an estimated nearly 10,000 dependent drinkers. So that's 10,000 people drinking so much alcohol that if they were to stop suddenly, they would go into withdrawal. Okay, more about that later. And these statistics, they're 2 or 3 years old now, as they always are with alcohol. It takes them a couple of years to crunch the numbers. We should get 2020's numbers soon, but that'll be a weird year because of COVID, which we're kind of coming out of now. It probably is just worth talking a bit about COVID-19 and how people have how it kind of interacts with alcohol. I guess the biggest trap with alcohol is that if you're having a tough time, if you're stressed, if you're tense, if you're anxious, if you're worried, if you have a drink, it'll relax you, it'll calm you down. This is the big trap with alcohol. This is how alcohol problems start, when people start using it to de-stress. Coronavirus, the lockdown, stressful time. So people did turn to alcohol to cope with the stress of the pandemic. If we look back at the last, the first lockdown more than 2 years ago now, back in March 2020, what we saw is supermarket sales of alcohol shot up because pubs and restaurants were closed. So people couldn't do their drinking at pubs, at restaurants. They'd do their drinking at home. Now, if you buy alcohol in a supermarket, it's cheaper. The cheaper it is, the more you buy. The more you buy, the more you drink. So we were seeing people who didn't have a drink problem before COVID develop alcohol dependencies, develop alcohol problems because of COVID. People with existing alcohol problems couldn't access the support networks that they previously could, things like AA. Those support networks kind of closed down, so they were kind of cast adrift. I should say that with Turning Point, we pretty quickly made the switch to telephone and online, where actually if you're working over the phone, you can reach a lot more people than you could actually if you insisted that people come in to see you. So yeah, we certainly seen people develop problems because of the pandemic, and things are still settling down now. Because all the lockdowns are over, people are kind of rushed back out to the pubs. So I think it'll take a year or two for the stats to settle before we can have a look back and see the full impact that it's had. Okay, so how much is too much? People are drinking too much. How much is too much? Well, the advice is the chief medical officer, who is Chris Whitty, the guy who was on TV every night during the pandemic. His advice is don't drink more than 14 units of alcohol per week. You'll become experts on units by the end of this session. So don't drink more than 14 units of alcohol a week. Now, that's not a safe amount, that's a low risk amount. The only safe amount of alcohol is none. But they didn't want to be that strict. They said, have a drink, but here's the low risk level. It's 14 units per week. Now, you can't have all your 14 units in one go on a Friday night, because that's a binge and that comes with its own problems. Nor can you have, say, 14 units per week. That's 2 a day. No, because you're supposed to have some days off as well, just to give your liver like a chance to repair. So it's a bit of a mouthful, but the current advice is don't have more than 14 units per week spread throughout the week with a couple of days off. That's the advice. It used to be different. People think, oh, it was 21 units for men and 14 units for women. It's all the same now. It's all 14. Okay. So that's the chief medical officer's advice, and that's the advice kind of like we as treatment professionals and the NHS that these are the guidelines that we stick to. Okay. So what is a unit? Know your units. So units are a great way of working out how much alcohol you're actually drinking, regardless of what kind of drink it is you're drinking. So whether you're drinking whiskey or you're drinking wine or you're drinking cider, if you know the units, you know the alcohol. And if you have an alcohol problem, you don't have a whiskey problem or a wine problem, you've got a problem with the alcohol in those drinks. Okay. So really important when you're working with someone who's drinking too much is to try and put a number on it. So you have a 20 unit per day drinking problem. And it's useful to quantify it like that, because if you don't, it can be really chaotic. So this 14 units per week guideline is there because the further beyond 14 units you drink, the worse we expect things to come. All right, so if you're drinking 15 units per week, you might get a couple of problems. But if you're drinking 50, 100 units a week, we'd expect things to, we might expect you to be depressed. We might expect you to have lost your job, maybe, so the problems stack up. You might get liver damage, that kind of thing. So we always encourage people to bring it down under those levels. Things get especially tricky when people drink beyond the threshold of dependence, which I've kind of teased already. So this is drinking so much that you withdraw if you stop suddenly. And that happens, everybody's different, but generally speaking, 10 to 15 units a day, that's kind of where it starts. Or you could say you're drinking your weekly recommended max, but every day. That's kind of where alcohol dependence starts. And we'll come back to that. So what is a unit? What does it look like? Well, one unit of pure alcohol, which is ethanol. Ethanol is the kind of alcohol we drink. There are other kinds of alcohol, things like methanol that you get in methylated spirits. I don't recommend drinking that. Ethanol is the kind of alcohol we drink. And 10 milliliters of that, not much at all, that's 1 unit. And you're going to get that in different strengths and concentrations depending on the drink you're drinking. So in spirits, in rum and vodka and gin, it's much more concentrated. In wines, it's a bit more diluted, and then in beers and ciders, it's more diluted still. Okay, and any drink you're going to have will have as a percentage alcohol by volume. So you know how much of that drink, what percentage of that drink is actual ethanol alcohol. So your spirits would be about 40%. Wine can vary. It can be between like 8 and 20% sometimes. So I tend to think about 12, 13% is kind of like an average wine. Beers tend to be 4 or 5%, but a lot of the strong beers that you can get in the shops can be up to 9, 10%. So it can be tricky, and if you're trying to like count your units, trying to keep on top of it, then it can be a bit tricky. Here's how I do it. This is how I work out how much somebody's drinking. You can say that 1 liter of anything will have in it the same number of units as the percentage strength. Okay, so let's say you've got a liter bottle of rum, and rum is 40% alcohol. There's going to be 40 units in that liter. All right, and people do drink a bottle of spirits a day, so they're drinking like 40 units a day. A lot of people drink cans or pints of beer. A pint is give or take half a liter. So what you do is you just halve the percentage strength. So if somebody's drinking a pint of 5% drink, you can say, well, that's 2.5. No problem, Dean. We'll catch you up. So if someone's drinking pints or cans, it's like half the percentage strength. So if I'm working with someone and they tell me, oh, Yeah, I drink 8 cans of Carling a day. Carling's a 4% lager, so each can of Carling is 2 units. They're drinking 8 cans. That's 16 units that person's drinking every day, which is already more than the weekly recommended limit. Right. So if you suspect someone has a drink problem, try and put a number on it, because it's really useful to know that number. And if you're ever going to try and reduce what they're drinking, you can do it by the number. Okay. We'll talk more about strategies for people to reduce as we go on. So that's units. That's the limits. So what can happen if you drink more than that? I mean, there are long-term problems and there are short-term problems. Generally speaking, in the work that I do, it's about looking at the longer-term problems. But we mustn't forget about the short-term problems, like things that can go wrong when you've been drinking, things like accidents. People wake up in hospitals sometimes. People wake up in police custody sometimes. Something's gone wrong along the line, that they did not plan their night to go that way when they started drinking in the evening. People get embarrassed, unsafe sex, unwanted pregnancies. People put themselves in a very vulnerable position if they've been drinking, so they can be taken advantage of. Whether that's theft or sexual assault, people can put themselves in a really vulnerable position. People can miss work because of hangovers, and then that can have sort of knock-on consequences. People do things they wouldn't have done sober. So a lot of violent crime is committed by people who've had too much to drink. And you might wake up with a hangover, being really regretful, thinking, I wish I hadn't done that. I wish if I hadn't have been drinking, I wouldn't have done that. Well, you try explaining that to a judge, they won't have a lot of sympathy for you. You've still got to do the time. But people are going to go out and drink. So a lot of the approach that we practice is the harm reduction approach, which is to say that people are going to be out drinking. How can they do it as safely as possible, and make sure they get home in one piece? It's not about saying thou must not drink, thou must be abstinent. It's about saying, if you are going to drink, how can you do it as safely as possible? So we say, if you're going out drinking, stay hydrated. This is a big one I learned when I was a bit younger. Alcohol dehydrates you, which is a surprise to a lot of people, because they think, well, it's liquid. I'm drinking all this liquid. How can it possibly dehydrate me? It's like, well, your body treats alcohol as though it were a poison, which it is essentially. And one of the ways your body deals with being poisoned is to flush out fluid. So actually, if you go to a pub and drink a pint of beer and then wait an hour and you go to the toilet, you'll pee out a pint and a quarter. So that extra quarter of a pint is your natural bodily fluid. Okay, so over the course of a night, somebody drinking all night, people get dehydrated. Their bodies are flushing out more fluid than they're drinking. Now, some of the subjective effects of dehydration can be agitation, aggression, memory loss. Things go wrong if you're dehydrated. So what we say is, if you're out drinking, stay hydrated. Every other pint you have of beer, have a glass of water. It makes a huge difference to the way the night ends up. Other advice: don't drink on an empty stomach. Eat before you go out. All the alcohol still has to go through your system, but if you've eaten first, it slows it down, so you don't get too drunk too quickly if you've eaten before you start. Stay away from the spirits, stay away from some of the stronger drinks, stick to beers, ciders, lower strength drinks, because you won't get so drunk so quickly. It's just about pacing yourself, is about doing things in moderation. And set yourself a limit, either a drink limit or a financial limit. Not always realistic when you're drinking, because limits can go out the window. You might say, I'm only going to drink 2 drinks tonight, but after that second drink, drinks 3 and 4 seem like a much better idea. But if you can set a limit, then do. So that's coming up. That's the short term, some of the short term risks and how you can mitigate those risks. More long term, people drinking more than they should for like weeks and months and years on end. People, you know, I work with people in their 50s, 60s who've been drinking every day since they were a teenager. You know, over time it takes its toll, and that can be on your physical organs, you know, your heart, your stomach, your liver, your pancreas, your brain. It can cause brain damage over a long period of time. We'll talk more about that as we get there. It can affect your cholesterol, your blood pressure, all sorts of stuff. It affects your immune system. I mentioned that there were 200 medical conditions that can be caused or exacerbated by drinking too much. There's things like cancers, liver disease, pancreatitis, depression, stomach problems, brain damage, diabetes, all sorts of things. We're not going to cover all of these right now. We don't have time, but I will try and hit some of the main ones. Just in terms of cancer, so like I said, when you have a drink and it gets in your bloodstream, it gets to every part of your body. So there's no part of your body that isn't exposed to it. So something like breast cancer, for example, drinking more than is good for you increases the chances of getting breast cancer because it's in your bloodstream. That aside, breast cancer, I'm thinking, kind of like on the front line of where things can go wrong is kind of everywhere between where alcohol goes in and where alcohol comes out. So that's kind of like your mouth, your throat, your stomach, your bowel, and ultimately you pee it out. So everywhere on that route is kind of like an increased risk of things going wrong, not just cancers. But let's talk about livers now, because if you ask like anybody on the street, like if you drink too much, what can go wrong, the chances are they might say, oh well, it's no good for your liver. That's true. Why? Because it's your liver's job to deal with all the alcohol that you drink. Your liver metabolizes all the alcohol out of your system, and it can do that at a rate of about 1 unit per hour. Okay, so I mean, we talked about units. So if you have a 2-unit drink, take you 2 hours for your liver to process that alcohol. You can then immediately see that if somebody is drinking 24 or more units a day, their livers are forever processing alcohol. They'll never get a break. Now, someone's asked if we're going to share the slides. Yes, we're going to share the slides. We'll send them out at the end. So every time your liver processes a bit of alcohol, it gets a tiny bit damaged. Now, ordinarily, your liver is really good at repairing that damage if it gets a chance. If your liver doesn't get a chance to repair the damage that alcohol is doing to it, then some of this damage can build up, and over time it can become permanent. Okay. So if you look at this slide here, you see in the top left, that's a healthy liver, nice and smooth and brown. That's what your liver should look like. Top right, if you're drinking too much for too long, some of the accumulated damage, the first stage of liver damage is fatty liver. Now that's what it sounds like. So if you've got fatty liver, your liver is surrounded by and infiltrated with fat, and that really interferes with the day-to-day running of your liver. All the jobs that your liver is supposed to be doing, which is something like 500 different things, all get deprioritized if you've got fatty liver. At that stage, however, it is reversible, because like if you've got fat on you anywhere, you know that if you really sort of worked hard, ate properly, and looked after yourself, you could lose some of that fat. So the same goes for fatty liver. If you can get off alcohol altogether, ideally, forget 14 units per week. If you can get down to 0, look after yourself, you can lose this fat and your liver can go back to being the healthy liver. If you carry on drinking, though, at that point, it can pass the point of no return. It can cross the bridge into permanent damage, which is the next stage, which is, if you look down in the bottom left here, we've got cirrhosis of the liver. You might have heard of cirrhosis. Cirrhosis is scarring. So this damage that's been building up rather than the damaged liver tissue getting replaced with new liver tissue, it's replaced with scar tissue. So not, which can't do the job of a liver because it's scar tissue, not liver. And yeah, we've all got scars on our bodies somewhere, haven't we? They don't go away. Once you've got a scar, you will forever have a scar. So if you've got a scarred cirrhotic liver, you always will have. The job then is about stopping the scarring getting worse, stopping it growing, because you can have a mildly scarred liver, a moderately scarred liver, and a very scarred liver. And there comes a point where it's more scar than it is liver. And along that way, it can cause all sorts of problems, which we'll talk about next slide. But the last stage on this picture, relatively rare, but if you've got cirrhosis of the liver, the chances of you getting it do go up, which is liver cancer. At that stage, really, it's more or less game over unless you get a transplant. But it's not like there are shelves of livers waiting to be put in people. And to be eligible for a liver transplant, you have to have stopped drinking and have demonstrated that you'll not relapse. So there's a huge element of luck in overcoming liver cancer. Most people, it doesn't happen. So if you've got one of these problems, how is it going to manifest? What kind of sort of, practically what kind of things can go wrong? So let's talk about some of the symptoms and consequences of liver disease. So you see this picture here, this chap, you can immediately see that there's two things wrong with him. One is that he's yellow, and the second is that his tummy is really swollen up. Okay, and these are both because he has cirrhosis of the liver. So first of those, he's yellow, so that's jaundice. Why is he yellow? There's a chemical in our bloodstream called bilirubin, and you can think of bilirubin as the yellow chemical. And bilirubin is what makes urine yellow. So when you go for a pee, it's yellow. That's the bilirubin. And ordinarily, it's your liver's job to take this yellow chemical and ultimately send it to your bladder so you can pee it out. If your liver is struggling to do that, maybe if it's got fatty liver or cirrhosis, that yellow has nowhere to go but your skin or the whites of your eyes, because your liver can't process it and send it around to your bladder. So that's jaundice. If you ever see someone who's yellow, think, this person needs to get in front of a doctor, number one. Is it because they've got liver problems, and is that because of their drinking? Secondly, this guy's stomach is not his stomach, his tummy, his abdomen is really swollen. Now that's fluid. That's fluid that has built up in his abdominal cavity, and it's kind of like for the same reasons. So ordinarily, your liver would take all this excess fluid you have in your system, send it to your bladder so you can pee it out. If your liver is struggling because it's damaged, that fluid has nowhere to go but building up on your abdomen. Now that can cause a lot of problems. That can put a lot of pressure on your heart, on your lungs, which can sometimes be fatal. Now the treatment, we call this ascites, by the way. Ascites, that's the name of this swelling of fluid in your abdomen. The treatment is they literally stick a tap in the side of somebody's tummy and drain it off over a couple of days. And people can have 10 liters or more of this stuff drained out of them, just while their liver kind of gets going again. There are two wards at the Royal Infirmary, called the gastro wards, which is full of people who have these kind of problems, and at least half the time I'd say that's down to drinking. So it's a huge problem. One more thing that cirrhosis can cause, perhaps the scariest. There's a huge vein that goes into your liver. It's called the portal vein, and it's not one tube. It's like a tree trunk. It branches around and goes into your liver, and it's very wide. And at the other end of this vein, the portal vein, it wraps around your stomach and your esophagus, which is your food pipe. Because when you start digesting food, the nutrients from that food, the first place they get sent is to your liver. So this portal vein takes nutrients from your stomach straight to your liver next door. So it requires the flow down this portal vein. A lot of blood goes through it all the time. There's a lot of flow coming through this vein. If your liver, however, is kind of clogged up with either fat or scar tissue, then the blood from the portal vein can't get in the liver quick enough. Now that means pressure builds up backwards along your portal vein, and all the veins that are wrapped around your stomach and wrapped around your food pipe, they get swollen. That's called varices. You see people with varicose veins, it's a really sort of prominent fat vein because they're swollen. Now, if you've got that coming up your food pipe, what can happen is that becomes so swollen it bursts and fills your stomach with blood, which you then vomit up until you've got no more blood to vomit. So if ever you meet anyone who's vomiting blood uncontrollably, think it might be that. That's a 999 job, by the way. That's a medical emergency. Now, all of these things are consequence of liver damage. Okay, so kind of scary stuff. When it comes to this kind of liver disease, the only advice we can give to people is try and abstain from alcohol totally. Forget 14 units per week. It's got to be 0 to give your liver the best chance of getting back on with its job. Okay, people who do have cirrhosis, something like 90% of those people, it's the thing that ends up killing them. But it doesn't have to be that way if people really do start looking after themselves. Okay, so that's alcohol and livers. Right, now let's talk about dependence. I've kind of teased this. Just have a drink. Alcohol dependence. This is really, really important. If somebody is drinking heavily every day, do not tell them to stop. Why? Because it can kill them. Okay, so we're talking about alcohol dependence. People who drink, everybody's different because, you know, we're different shapes and sizes, but generally speaking, if you're drinking 10 or more units per day, you kind of go into this realm of being alcohol dependent. You know, I think probably the most alcohol I've ever worked with someone is someone who drink 3 liters of vodka, so that's about 60 units a day. That's a huge amount. Don't stop if you're drinking heavily because of these alcohol withdrawals. Okay, so alcohol withdrawals happen on a kind of spectrum. There's more than one symptom, and the alcohol withdrawal symptoms go from mild to moderate to serious and life-threatening. Okay. If you have a look at this chart here, it kind of goes up in order of severity. And you know, the more dependent somebody is, i.e. the more they're drinking every day, the worse these symptoms become. Okay, so the most mild, the most common symptoms might be night sweats or waking up sweating, or kind of hot and cold flushes, really common. People might get might shake in the morning. They might get a bit of tremor in their hands in the morning. Yeah, these alcohol withdrawals tend to be worse first thing in the morning, because if you think about it, if you've been asleep for 6 to 8 hours, you haven't been drinking, it makes sense why you withdraw more first thing in the morning. Okay, and some people do have a drink as soon as they wake up just to settle themselves. Anxiety, really, you know, people kind of panic in the mornings. Bit more serious, people get nauseous. They might vomit, or they might just heave, but nothing comes up. You know, it's their body saying, I need a drink, I need a drink. Bit more serious still, people can start hallucinating. That can be visual or auditory hallucinations. You know, people can see shapes out of the corners of their eyes, or hear voices in the next room, up to really kind of vivid, scary hallucinations, like somebody's long dead grandmother just walked into the room and started talking to them. Beyond that, it's kind of like medical emergency territory. All right, alcohol withdrawals can cause seizures. People can have a fit. It can put people in a coma, and it can even kill you. All right. So really important, you tell someone who's drinking heavily, don't just stop. There's also this thing known as delirium tremens, the DTs. This is a bit misunderstood. People get the shakes and say, I've got the DTs. That's not the DTs. That's just a tremor. The DTs, delirium tremens, is a kind of like full-blown delirious psychotic episode where people won't know what's going on. They'll be really agitated. They'll be hallucinating. They won't have capacity. Their heart rate will be through the roof, as will their temperature. And actually, it's for those reasons that the DTs kills something like 1 in 5 people who get it. That's why that's a medical emergency. Okay. That's really important that we as kind of like professionals do advise people drinking heavily not to stop suddenly, because one of the things that surprises me about alcohol withdrawals is why more people don't know about it, including people who are drinking heavily. So quite common at the Royal Infirmary, we'll get people drinking heavily, drink a bottle of vodka every day. One morning they wake up, they say, right, I've had enough, I'm gonna knock it on the head. And then come tea time, they're in the back of an ambulance having had a seizure. We also need to educate like loved ones, like relatives who can often like lay down an ultimatum, you need to stop drinking right now or I'm leaving. It's like, no, because if they stop drinking right now, it could kill them. All right. Now, this kind of puts people between a rock and a hard place. Maybe somebody is drinking so much that they need to quit. Well, oh, Gina's muted herself. Good, well done, Gina. People need to quit because maybe they've got cirrhosis of the liver. Maybe their life is falling apart around them. They need to get off the alcohol. But I'm saying, well, you can't just stop. What do you do if you are alcohol dependent? How can you get off it? Well, the answer is you need to wean yourself off. You need to wean yourself off safely. That's the answer. Or as we put it, stabilize and reduce. This is the safe way to get to break someone's physical dependence on alcohol. So the first part of that is to stabilize, because what you'll find is a lot of dependent drinkers are actually chaotic dependent drinkers. Like, yes, they withdraw, but one day they're drinking 2 bottles of wine, the next day they're drinking a bottle of vodka, next day it's 10 beers. They're dependent, but it's up and down. So job one is to stabilize it. So it's about finding an amount of alcohol, an amount of alcohol that keeps you ticking over for 24 hours. Not so much that you're drunk, and then not too little that you're shaking and sweating, just enough to keep you steady. And like I said earlier, you can put a number on that. You can say, right, you are 20 units per day alcohol dependent. Because once you've stabilized, what you do is you take that number and you knock it down by 2 every couple of days. And so 20 units, 18, 16, and so on. Yeah, okay, so I'm just looking at the chat. So you wean off steadily. If you can get down to comfortably under 10 units per day, then you're probably out of danger of some of the scarier withdrawals. So if you get down to comfortably under 10 units a day, you can experiment with having days off or stopping entirely. Okay. So that's the textbook way of doing it. Easier said than done, which we'll talk, because I think we need to talk about addiction. But before we do, there's another way of doing it. There's another way of breaking someone's physical dependence on alcohol, and we call that a detox. So a detox is a medical procedure whereby you can break someone's physical dependence to alcohol. Now, the way it works is we use a family of drugs called benzodiazepines, the most famous one of which is Valium. We tend to use that, or Librium is another one, to do these detoxes. These medicines work on the same parts of the brain as alcohol. So if someone's drinking 20 units a day, then they stop drinking. We give them, say, 20 milligrams of diazepam 4 times a day. That's as though they're drinking 20 units. So they don't withdraw, that their brain is satisfied. And then over the course of a week, 10 days, which is about how long a detox lasts, it's the diazepam, it's the medicine they're weaned off. Yeah. So you swap the alcohol for pills and you wean off the pills. That's a detox. And we can do that. We do that in the hospital if someone is alcohol dependent and they are hospitalized. I don't know, maybe they've got liver damage or maybe they've broken their pelvis or something. They need to be in hospital. We're not going to give them drink, but we don't want them withdrawing. So we will detox them whilst they're in hospital. Out at Turning Point, we can arrange detoxes for people as well. But we don't just detox people left and right just because they're alcohol dependent, because they tend to fail. If you just detox somebody because they ask for it and they're alcohol dependent, what will happen, certainly more than half the time, is that that person will relapse. Why will the person relapse? Because they have an addiction. And when you're trying to get over alcohol, you have to understand there's a difference between dependence and addiction. So dependence is that physical need for something. You're drinking so much, your body has made changes and expects alcohol, or you will go into withdrawal. That's physical dependence. Addiction is something else entirely. Addiction is kind of like the psychological version of dependence. It's when you're drinking so much that you come to psychologically need it, or you will not withdraw, but something feels very wrong without it. Okay. The two usually go together. So if you are dependent on alcohol, I'll bet you're addicted to it as well. You kind of pick up the addiction as you go along. So if you're trying to get off it, you know, you've just been told you've got liver damage, you want to get off it, you've got to deal with the physical dependence and the psychological addiction. Now, the problem with addiction, people with addictions get a lot of stigma. You know, the common mantra is, well, why don't you just stop? You know, nobody's holding a gun to your head. You know, pull yourself together. You know, come on. It's like a failure of character if you're addicted to something. You know, just stop. And it's not that easy. We have, especially us as professionals, have to understand that addiction is an illness, which means it's a pathology. There's kind of like a. I'll explain about how addictions work. So, evolutionarily speaking, we're kind of predisposed to keep doing things compulsively that help us survive. So, like eating feels good. Oh, that feels good. Do that again. Or sex. So sex feels good. You want to keep doing it, and you know, therefore, you know, the species continues. Or even something as simple as breathing. Breathing feels good, so you want to keep doing it. So it makes sense that you've got systems like that within you. What addictions do is they hijack that system. So you can say, oh, you've had a tough day, have a drink. That feels good, do it again. And the way we learn is through practice, is through repetition. So the more you do something, the more automatic it becomes. So you're learning how to ride a bike. The first time you ever get on a bike, you're going to fall off. You've really got to concentrate on what you're doing. But the more you repeat it, the more you practice it, your brain, the bike riding circuit in your brain gets stronger and stronger to the point where it's just automatic. Okay. Now, if you apply that logic to things that are bad for you, like drinking or like smoking or like gambling, if you repeat it, you know, put a wager on a horse, that feels good, do it again, and repeat. If you repeat it enough, it passes a point where it becomes automatic. Okay, where like free will or a decision-making process, a thought process, is removed from the equation. It just happens compulsively. At that point, it is an illness. It is pathological at that point where it becomes automatic and compulsive to do it. And that's addiction. And people who have that illness, we've got to treat them as professionals with the same level of empathy understanding, and respect as we would anybody else with any other kind of illness. Okay, and I do see too often people who should know better making this mistake. I'm thinking of GPs and the police in particular. You know, people with addictions are human beings just like any of us, and we have to treat them with that kind of respect. And so overcoming an addiction is not just about stopping. It's not about pulling yourself together or practicing a bit of willpower. It's not impossible. The treatment is to replace those bad habits with new, more positive habits. And then the idea is that that will in time become the compulsion. Okay, nobody cares about people being addicted to positive things. You know, you're addicted to going running, fine, go run. Okay, no problem. So if you turn to alcohol at the end of every bad day, well, let's try and have a new habit. Every time you have a bad day, you go for a run around the park, and pretty soon that becomes the compulsion. That addicted circuit in your brain kind of remains there dormant. But once you learn something, you can't unlearn it, which is why they say you never forget how to ride a bike. And there's also the saying, once an alcoholic, always an alcoholic, because those compulsions are always there, even if you're not acting on them. So people can go years without a drink, and then one drink and they're back off at it. Or you might not have got on a bike for 20 years, but if you do, you know, away you go. I mentioned the word alcoholic. It's not a word we use professionally, because the word alcoholic comes with a lot of stigma. You know, it can be a pejorative term, alky, and it's also people who do have alcohol addictions sometimes like to label themselves as alcoholics because it gives them permission to carry on drinking. Of course I drink, I'm an alcoholic. It kind of takes away any agency they may have in doing anything about it. So it's not a word we use. Having said that, my idea of what an alcoholic is, kind of like dictionary definition, is, and this kind of points to addiction in general, is somebody who carries on drinking despite overwhelming evidence to them that it is doing them harm. Okay, so you know somebody is addicted to something where they've just been diagnosed with cirrhosis, but they're carrying on drinking, or the gambler who carries on gambling even though they've just had their house, they've just lost their house, or the heroin addict who carries on injecting even though he's just had his leg amputated, which happens. Yeah, how strong must that compulsion be if you carry on doing it despite all these bad things that are happening to you? So that's not a failure of willpower. That's a disease. There are, we don't have time to go into all the sort of tools in the toolbox about how you might treat someone with addiction. You know, this is it's not easy, certainly not easy, even if you know what you're doing, which we don't always. Generally speaking, with alcohol, like I said earlier, the trap with alcohol is that it relaxes you. It is a muscle relaxant. It is an anti-anxiety drug in the short term as it's going down, and that's where the problems develop. People start using it for that reason. And one strategy we have for treating that is to first of all help people identify what their triggers are for using alcohol. Now, anything can be a trigger. It can be people, places, things, anniversaries. I'd say the number one most common reason trigger I hear why people drink is boredom. Got nothing to do, helps pass the time. It's like, yeah, if you are bored sitting at home twiddling your thumbs, alcohol will help you pass the time, but it also causes all these other problems. Stress, depression, loneliness, bereavement, not being able to get to sleep. These are all really common triggers that I hear for why people drink. So if these are the reasons behind someone's reasons for drinking, you need to say, well, how can you cope with those things differently, you know, without alcohol in a more healthy manner? So if you're bored, it's not rocket science. If you're bored, you need to find something fulfilling to get your teeth into, something that gets you going in the morning. It's not a question we can answer, but it is the question we should be asking. It's going to have a different response for every person. You know, hobbies, interests, get a job, do something that gets you going. If you're trying to get over an addiction or a dependence, the worst thing you can do is nothing. The worst thing you can do is sit at home twiddling your thumbs, because you will be drawn back to it always. If you drink to help with stress, there are better ways of de-stressing. There, you know, have a bath, go for a walk, listen to music, whatever floats your boat, whatever works for you. You need a better way of doing it. Some on this list, like say depression and sleeplessness, people drinking for those reasons. Sometimes that's a bit of a vicious circle. Like, I drink because I'm depressed. Well, has your depression got anything to do with the fact that you drink 2 bottles of wine a day? Or sleep's really common. People reducing what they're drinking, their sleep suffers in the short term. People doing that reduction I was talking about earlier, or people doing a detox, their sleep suffers. They won't be able to sleep, which can be really discouraging for people. So I've stopped drinking, but I can't sleep. If only I had a drink, I'd get a good night's sleep. That's only true in the short term. If people can stick with it, their sleep will start improving in time. The reason their sleep was rubbish in the first place was because they were drinking. Okay, so that can be a hard one for people to kind of punch through when they're getting over an alcohol dependence. What else can we do? There's kind of like some of the tricks in the box when you're working with people with addictions. There will always be a voice in your head that is trying to get you to have the thing that you're addicted to. We call these permission-giving thoughts. There'll always be a voice in your head saying, "Oh God, you've had ever such a hard day. Have a drink. Go on, you need it. You need it. You can't cope without a drink. No one will know. One won't hurt." All these thoughts trying to get you to, you know, nip down the shop and buy that bottle. This is that addicted circuit in your brain talking. Its only agenda is to get a drink in your hand. It doesn't care about the consequences. It doesn't care about your liver or your mental health or your relationship. And as soon as you've got that drink, the voice shuts up because it's happy, and it leaves you to deal with the consequences. So one thing that we encourage people to do is to spot these thoughts when they come. Put a big red flag. I know why I'm thinking this. I don't have to go along with it. You're challenging these thoughts, because one thing all these thoughts have in common is that none of them are true. You need a drink, really? You're going to drop dead without it? Which you might be if you're dependent. Well, like, one won't hurt. Well, yes, it will, because it'll always lead to 2, 3, 4. No one will know. Yeah, they always know. You can't hide an alcohol problem from people. People kind of know. So these are just a couple of tricks in the box. Motivate. We do need to talk about motivation. Earlier on in my career, when I was an alcohol counsellor at the Criminal Justice Drugs team, it's very easy to spot when someone's got an alcohol problem, and you might work with them to say, well, how many units per day are you drinking? Okay, stabilize that. Cut down by 2 units every other day. Tell me what you triggered. Come back next week and we'll look at it all. And people would come back the next week and they hadn't done any of that. Why? Because they weren't motivated yet. People might know they've got a drink problem, but they're not nearly at the point of saying, okay, yes, I need to do something about this. When and how, you know? If people who aren't yet motivated to make changes, if you go in and start saying, this is what you need to do, they won't. They'll just put up barriers and sometimes make matters worse, because, you know, it's kind of like natural to resist unless the motivation comes from you. So a big part of what we do is gauging where somebody's motivation is, and if they're not yet at the point of, okay, the time is now to do something about this, then we kind of, our job is to help inch them nearer to that. And a lot of that might be reflecting people's situation back to them. You're saying, you're drinking X number of units per day. What impact is that having on your mental health, your relationships, your job? So people can start to see the big picture of what they're getting from alcohol, but everything it is taken from them. And then perhaps see a brighter future where some of those issues aren't so much of a problem. It always seems to me, having done this job for a while, is that people drinking a lot will have lots of different problems, and that their alcohol consumption is often the reason behind all these problems, and addressing the alcohol problem is the key in solving those problems. People prioritize overcoming their drinking, then lo and behold, they're happier, they're getting on better with their partner, then they're not missing work, everything kind of gets better. Finances, it's an expensive habit, drinking these days. It's like smoking. Okay, so we've talked about units, we talked about dependence, we talked about livers, we talked about addiction. Let's talk about a few other things in the last half hour of the session. Excuse me. So there's a few other bits and pieces I want to cover. So for the next bunch of slides, we're going to be kind of jumping around the place a bit. So the first thing I want to talk to you about in this bit is something really common that you've probably never heard of. I want to talk to you about Wernicke's-Korsakoff syndrome. If you've heard of this, then a brownie point to you, because a lot of people haven't, but it's really, really common. You might have heard of Korsakoff's, you might have heard of Korsakoff's disease, but I need to tell you about this because it is so common. So what is this? Alcohol negatively affects your appetite. People drinking heavily don't eat much. And the reason there's a few reasons for that. One of the reasons is there's a lot of sugar in alcohol, and all this sugar, this is if you're drinking heavily, all this sugar hits your stomach and tricks you into thinking that you've eaten. So it turns off your appetite that way. Also, alcohol irritates your stomach. Alcohol is a solvent. It's like a cleaner. So your stomach's getting cleaned and not in a good way. So it can give people indigestion. So for those reasons, it puts you off your food. Certainly the case, I've worked with people drinking heavily, and they say they've not eaten in days or weeks. Yeah. The problem, if you're not eating, is that you're not getting any nutrition. We're made of the food we eat, and if we're not getting any protein or vitamins or minerals or fiber, things are going to start going wrong. Medically, what we worry about in particular, where alcohol's concerned, is a vitamin deficiency, vitamin B1 in particular, also known as thiamine. Thiamine is what your nervous system and your brain need to function properly. Thiamine is like the grease that makes your nervous system go. All right. So what Wernicke's-Korsakoff syndrome is a thiamine deficiency syndrome. So you can imagine that if someone is deficient in the thing that helps your nervous system, you might have symptoms that kind of go along with that. So what you need to look out for is symptoms like this: clumsiness, people not being able to sort of walk properly, not being able to coordinate their limbs, which can appear like drunkenness. So that's alcohol too. People not being able to balance. People get memory problems. People get short-term memory in particular. So there's long-term memory, things you did years ago, and then there's short-term memory, what you had for breakfast. We see people with short-term memory problems. People get confused. People get disorientated. So what I will do is, if I'm at the hospital and I'm talking with someone who's drinking heavily, I'll say, this is not a trick question. Can you tell me today's date? And they might say, of course I can. January the 1st, 1983. Silly question. It's not. It's 2022. Or you might say, can you tell me where we are right now? And it's obvious we're in a hospital ward. But they might say, well, yeah, you're in my front room. How did you get in? Who let you in? That kind of thing. It's kind of disorientation, but it's as though they believe what they're telling you. Another common symptom is pins and needles in your fingers and toes, or numbness or tingling. So if you get that, it's not a problem with your fingers and toes. It's like the message isn't getting along your nervous system, again, because of this thiamine deficiency. Eye problems, flickering eyes, either like flickering left or right or up and down, call that nystagmus. These are common symptoms of people with a thiamine deficiency, often because they're not eating, because they're drinking too much. Okay, now medically we worry about that, because if you don't catch this in time, it can lead to permanent damage. Right, all those symptoms I just described, that's kind of like the Wernicke's side of Wernicke's-Korsakoff's, and you can treat all that. If you don't catch it in time, it sort of ticks over into Korsakoff's, and Korsakoff's is like the irreversible syndrome. Okay, and you can think of Korsakoff's as like kind of like an alcoholic dementia. So people with Korsakoff's will forever have memory problems. You know, they won't be able to form new memories. They won't recognize people. They will forever be disoriented. And people with Korsakoff's, really, you're kind of looking at residential care, you know, for the rest of their days. And this is getting people earlier and earlier. I've seen people in their 40s, even late 30s, even get this kind of stuff. So it's really common. So common, in fact, that if you go to your GP and you say, doctor, I think I've got a drink problem, one of the things your GP will do is prescribe you strong vitamin B. Because this thing is as a vitamin B deficiency, the treatment is with vitamin B. And in the hospital, we give it intravenously on a drip. You know, we fill people with huge amounts of vitamin B just to try and reverse the early stages of this, to try and prevent it becoming that permanent syndrome. You can't overdo it with vitamin B. Your body takes what it needs and you just pee out the rest. So, you know, we flood people full of it. So bear that in mind. If you guys work with anyone professionally and perhaps they're a bit confused, perhaps they're disoriented, pins and needles, tie that in with what they're drinking. You know, again, units per day. Is it an issue? Do they need to get help with their drinking? Do they need to be on thiamine? You know? If people can reduce what they're drinking, people's appetite should come back. So ultimately, people should get all the vitamins they need from the food they're eating. But in the short term, you can prescribe. Okay, so that's something. If this is one of the new things you might not have heard of, that hopefully you can take forward after this. So that's Wernicke's-Korsakoff's. Be on the lookout. Okay, changing subject now. Alcohol and pregnancy. So I think the advice used to be you could have 1 unit per day if you were pregnant. No, the advice now is 0. If you're pregnant, don't have any alcohol. It's just not worth the risk. A lot of people find out they're pregnant, what is it, kind of like 6+ weeks into pregnancy, and they might have been drinking for those 6 weeks and panic. Don't panic, just nip it in the bud, safely. If you're dependent, you know, you still need to wean off safely, but quickly. Get off it as quick as you can. You're unlikely to have done any damage to baby, but the chances do go up the more you drink, the longer you drink while you're pregnant. What we're worried about drinking when you're pregnant is fetal alcohol syndrome. So if you take a look at this picture here, he's a cute kid, right? But if you look closer, there's a few things not quite right about him. Fetal alcohol syndrome can cause some abnormalities in facial features. It can cause problems with body weight, height, head circumference. It can cause behavioral problems, autism, ADHD, learning difficulties, that kind of thing, sensory difficulties. Because of the presence of alcohol in the womb, baby didn't quite develop properly. This is what we're trying to avoid. Okay, so that's fetal alcohol syndrome. How are we doing for time? Not too bad. Not too bad. There'll be time for questions at the end. Yes, I'm not going on too badly. Okay, changing subject again, alcohol and calories. So I didn't think this needed any text. I thought the pictures would do it. I've researched this. These are accurate. Like I said, there's a lot of sugar in alcohol. Sugar means calories. And there's more than you'd think. So a bottle of wine, that's the equivalent, same number of calories as a Big Mac. Pint of beer, same number of calories as a Mars bar. Down the bottom there, that's a double gin and tonic, which has the same number of calories in it as 2/3 of a Kit Kat Chunky. So if ever you're trying to lose weight, pay attention to the alcohol you're drinking as well, because that's going to be a huge factor. This is kind of like what's behind beer bellies. As a man, if you're trying to lose weight, look at what you're drinking, because it's going to be a big factor. So some people will, people will say, oh well, yeah, if they're not eating, they say, well, I get all my calories from the alcohol I'm drinking. They're not good calories. They're not the kind of calories that you can survive off. They're what we call empty calories. They just kind of sit on you. They don't really energize you in any way. So yeah, more calories than you'd think. Changing subject again. Let's talk about driving and alcohol. It's quite a common question we get asked is how many beers am I allowed to drink and not be over the limit? And the answer is none, because everybody's different, and we don't know how many drinks, how many units will translate to the drink drive limits. Okay. The drink drive limits are 80 milligrams of alcohol in 100 milliliters of blood. Now, if you get stopped by the police and breathalyzed, what they're looking for, let me get this right, 35 micrograms of alcohol in 100 milliliters of breath. If you fail that, they will take you to the police station where they will do a blood test. And then if you get 80 milligrams of alcohol and 100 milliliters of blood, then if you exceed that, then you will get prosecuted. Okay. If you get prosecuted, you will lose your license for a year and have to pay a fine. Okay. Or if you're really far beyond the limit, the penalties can be worse. Okay. Now, bearing in so there's no way we can translate those numbers into units, into drinks. So the only advice we can be is like, don't do it. Alcohol and driving do not mix. But bear in mind, it takes your liver about 1 hour to process each unit of alcohol. If you go drinking on a night out, you could have 20 units, you'd probably still fail a breathalyzer well into the next day. And a lot of people do get done for drink driving in those circumstances, the day after they've been out drinking. So it's always something to bear in mind. When it comes to alcohol dependence, you shouldn't be driving at all. In fact, if you have a driver's license and you're alcohol dependent, what you should do is inform the DVLA. I am alcohol dependent, whereupon they will take your license off you for a year up until the point where you can demonstrate you have overcome your alcohol dependence. Okay. Because, if you're alcohol dependent, you have to be drinking, otherwise you'll withdraw, which means at any point in a 24-hour period, you would probably fail a breathalyzer. Okay. One thing we haven't talked about with dependence is the higher your dependence goes, the more units per day you're drinking, actually your tolerance goes up with it. So tolerance and dependence always go hand in hand. The more you drink, the more tolerant you get, to the point where you might be able to drink 5 pints and feel sober because you're tolerant to 5 pints. But the law doesn't care about that, and breathalyzers don't care about that. The judge wouldn't care about that, and the person you've run over certainly doesn't care about that. So saying you have a tolerance to alcohol is no excuse to drink drive. Okay. the DVLA thing can be a bit of a problem. And for some people, it's a good reason to get off alcohol, because people want to be able to drive. People don't want their license taken off them. When it comes to getting support from somewhere like Turning Point, the way the law works, we have to explain this to people about the DVLA, and we have to say, if after say 28 days we think you're still out there driving and haven't informed the DVLA, then it becomes our responsibility to inform the DVLA. Because, you know, if you go and kill somebody and the judge says to us, you knew he was alcohol dependent, why didn't you tell it? Why didn't you tell us? Then we're in trouble. So it can sometimes it works as a barrier to treatment, but sometimes you can sell it as like a motivating factor why someone might want to overcome their drinking. So that's driving and alcohol. Oops, skipping ahead. Let's just talk about, I could talk more about this, alcohol and mental health. You know, you could do a whole presentation about alcohol and mental health. Alcohol is a depressant in two ways. It's a depressant physically in that it slows everything down. It slows your heart rate down. It slows your breathing down. But it's also a depressant in terms of your mental health. It's very rare I meet someone who's, say, alcohol dependent and they're not depressed. It's like, if I wanted to get depressed, I'd start drinking 2 bottles of wine a day. It kind of goes hand in hand with it. The problem is a lot of people drink, their trigger is their poor mental health. So it helps alcohol helps me cope with my depression. Let me tell you, you're never going to overcome any kind of mental health problem if you're drinking heavily. Yeah. Things like medication, like SSRIs, things like Prozac, that family of drugs, they can be really effective, but not when you're drinking. The metaphor I like is it's like throwing an ice cube into a fire. If you're on antidepressants and you're drinking heavily, it's a step in the right direction, but it won't be doing anything. So if ever you've got mental health problems and you're drinking heavily, prioritize the alcohol. Try and get off the drink. 14 units, ideally 0. Give yourself a couple of months off it. See what your mental health's doing then. If you can do that, any medication you are on will get the chance to start working. So there'll be kind of like a double antidepressant effect. There's no alcohol, antidepressant. The medication starts working, antidepressant. Which is kind of oversimplifying it, because, you know, people might have been through traumatic events or bereavements, things that might be kind of like a good reason to be depressed, but they're never going to be able to deal with and process that trauma whilst they are drinking. And exactly the same thing goes for drugs. You know, we could be talking about drugs doing this, because the way drugs and alcohol work by definition is they mess with your brain chemistry. They're psychoactive because they chemically alter your brain. We experience that subjectively if we overdo it as depression, despair, hopelessness, anxiety, sleeplessness. We need to level off the brain chemistry, and we do that with food, water, and sleep, not drugs and alcohol. But it can be a really tricky one, trying to pull apart somebody's substance misuse problems and their mental health problems. Okay, but it kind of has to happen. Right, so you've got a few minutes left now. So I've kind of covered a lot. It's a bit of a sort of a splattergun approach. There's lots that we could talk about but haven't. Let's talk about some of the support available. Like, it's pretty easy to spot somebody who's got a drink problem, and hopefully with some of the physical symptoms that we've talked about today, you might be on the lookout for people who might have a drink problem and that you previously didn't suspect. If you can have conversations with people that maybe they are drinking more than is good for them, they recognize that and want to do something about it, what support is out there? Well, it is Turning Point in Leicestershire, Rutland. So I kind of gave you a bit of a history about it earlier on. Our main base is in Leicester city centre, but we do have a hub in Loughborough, one in Colville. We see people in Hinckley, Market Harborough, Lutterworth, Oakham, we're all over the place. We see adults, young people, we've got a criminal justice team, and we're in the hospitals. So wherever you are in the city and county, Turning Point are there. If you meet a member of the public who might have an alcohol problem, wants some support, either you or they can refer themselves in. If that happens, what can they expect? So if somebody gets referred into Turning Point, what will happen is they will get allocated a recovery worker. So I'm a recovery worker. That's just the term we use for drug and alcohol counsellor. And that recovery worker will be their main contact, who with the person will devise a care plan of how best we can help people. Okay, so it's kind of like a pathway approach. So we've got a dependent alcohol pathway, a non-dependent alcohol pathway, an opiate pathway, a crack cocaine pathway, whatever it might be. And the main sort of treatment package is like a group work program, which is kind of, it had been mothballed for a couple of years, what with COVID, but we're kind of bringing it out again now in a kind of face-to-face group work setting. There's a bit of anxiety people have around group work programs, because people think of AA, people think, oh, I've got to stand up in front of a circle full of people saying my name's such and such and I'm an alcoholic. It's not like that. It's more like it's more of a program, like a course, and it's a cognitive behavioral therapy approach. So that's a course where people can learn what makes their addiction tick, learn how to recognize addictive thought processes. So it's kind of like the stuff I was talking about earlier about identifying triggers and developing coping strategies, identifying permission giving thoughts, that kind of thing. So that's the kind of program approach, which mainly over the last 2 years has been happening remotely, either over the phone, one-to-one, or this kind of using this Teams software, which we found pretty effective. But we are moving back into like a face-to-face approach now. And all of that work is kind of like relapse prevention. So there's always two jobs if you've got an addiction. One is getting off the thing you're addicted to. The harder, longer job is staying off it. So having stopped, how can you prevent a relapse? Okay, and again, it's all that cognitive behavioral kind of stuff. Turning Point have a clinical team. So we have a consultant, doctors, nurses, prescribers, all of whom are experts on drugs and alcohol. One of the main things they do is something called opiate substitute treatment prescribing. So this is mainly for people who are heroin users. So heroin is an opioid, and you can get dependent on opioids in a similar way you can with alcohol. What we do is we prescribe something called methadone, which is an opiate. So the idea is people take this methadone, they can stop using heroin, and then they won't withdraw because they're still getting an opioid, and then we can wean them off that. And while people are on methadone, they can get back on with their lives without having to do all the grotty things that usually come with a heroin addiction. And we run a needle exchange. If people are going to be injecting heroin, how can they do it as safely as possible? Again, it's not about saying thou must not do drugs. It's about saying, if you're going to, here's how you can do it as safely as possible until you're ready to think about quitting. Likewise, we do testing for bloodborne viruses, things like hepatitis, HIV, that kind of thing. And if anyone were to test positive for those kind of things, we can plug them straight into the appropriate teams. I mentioned detox earlier, so Turning Point can arrange detoxes and rehabs, slightly different things. So the detox, remember, is the usually 7 to 10 days where someone goes in. We use a purpose-built detox facility in Nottingham, which is as comfortable as possible, and there's lots of wraparound kind of like psychological support and the cognitive behavioral support while the person's doing the detox. So we can arrange that for people. Rehab, slightly different. Rehab is somewhere you go and live for 3 months, usually, having been detoxed. So you've got the drugs or the alcohol out of your system. You then go and live somewhere residentially and learn how to cope with day-to-day living without that thing that you were dependent on. That's rehab, and Turning Point can arrange that as well. We have the peer mentors, the peer mentor program. So the peer mentors are people who have been there, done that, got the t-shirt, they've overcome their dependencies, their addictions. We train them up to volunteer, and then they act as positive role models for people coming in at the start of the process. People can see, oh, that person there sorted themselves out, they're doing well, I can do it too, that kind of thing. And it's certainly the case that when jobs come up for recovery workers, it's often the peer mentors that get those jobs. So there are people who work at Turning Point who do my equivalent job who have themselves overcome addictions. Okay. So they're a valuable asset to Turning Point. Other bits and pieces, we've got a family team for partners, and when it comes to family members, if the whole dependence thing, what I was talking about earlier, they need to know the correct advice to give. You know, maybe they come from a good place, they want their loved ones to get better, but don't quite know the best advice to give. So we've got a family team who can work with those kind of people. And then we do like holistic interventions. So if you say people use alcohol to relax, okay, well, are there any other ways you can relax? And it's things like mindfulness, meditation, yoga, art classes, music, that kind of thing. So all of that is what's available through Turning Point, for free for anyone who's got a drug or alcohol problem in Leicestershire, Rutland. So there are as many referral routes in as possible. People can self-refer. You guys, as long as you've got the person's consent to do it, you can refer people in. The best way of doing that is online. If you Google Turning Point Professional Referral, it's the top result. Okay, and you just follow your nose, enter the person's details. It'll ask, is it drugs or is it alcohol? And enter their details and we'll take it from there. Okay. Right, that's it. I'm about to lose my voice. Does anyone have any questions about anything we've talked about or anything we haven't talked about? Stick your hand up, unmute yourself, and I'll come to you. No? No questions? All right then. Bryony, anything you want to say?
No, just a big thank you, Drew, for obviously delivering the session today. I hope everyone found it useful. As I was about to say, we've got a little survey that if you can complete really quickly before you finish the session today, that would be great. It will just take 2-3 minutes, no more than 3 questions, just to help us inform next year's festival and let you know, let us know what sessions people have found really helpful this week. But yeah, a big thank you, Drew, and thank you to those that have joined. Make sure you do have a look at the programme for sessions that are taking place tomorrow, and get involved if you've got a bit of time to spare tomorrow. But thank you very much.
Thank you, everybody. I enjoy doing these things, so thanks for coming and enjoy the rest of your afternoon.
Thank you. Thanks a lot. That was really good. Thanks.